Maybe we'll just take a few minutes right now to talk about informed consent and what is it really? What are the components that ensures that a patient can make a decision with all of the information that they need to make that decision?
I want to read to you what a description of what informed consent means. So, consent that has been voluntarily given by a patient or authorized decision maker who is legally capable of giving consent, who has been fully informed about the nature of the proposed care, including how it relates to the patient's condition, the risks, the benefits, and any available alternatives of the proposed care, if there so is any, and who has been given an opportunity to ask questions and receive answers about the proposed care. So it is involved. Informed consent is really involved. It goes way beyond the fact of, do I have consent to administer a vaccine on you? But rather all the things that go within it. You should understand the infection you're vaccinated against. You should understand the vaccine that which is being used. You should understand the risks and the benefits so that you would never come back and say, I didn't know that. You should know all of that before going in. And that is the kind of care that I provide. I don't care what people's decisions are. I don't have any personal, I need you to do this and I need you to that. And I hold that in me. No, what I care about is people are informed before they make a decision. That's my job. My job isn't to have a personal relationship with your decision making. No, I need to be that unbiased person to give that transparency to you so that you've made a very conclusive decision. And so you know what the risks are. You know what may happen if you do or you do not. That is very clear in your head so that no matter what happens, it does fall on you, on your choice. And so you need to know what your decision, the outcome can be. And so this is what's happening with parents today is they want to be fully informed because now we want to be fully informed about the car seat. I want to know the history of it. We're really in an age of education. We're really in an age of asking questions because we also have the access to. No one wants to just hear from their provider, it just is, therefore do. That's not how we don't have that relationship anymore. It's I have a question and I do expect you as a professional and the expert to answer it. And if you cannot answer it, then you should be very clear that you don't know. And in actuality, when you proclaim that you don't know the answer, the trust is actually stronger between you and the patient because I know that you're being honest. So if you're being honest, then I have way more trust in what you're saying to me. If you just sort of skirt around it and make up, I think you're making something up or you're deflecting, the trust starts to dwindle away. And so I leave with more questions and confusion and not sure what to do now. So that's a ballpark of what informed consent is. And it's very clearly laid out around vaccines, how we achieve informed consent.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel. And don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.